Hi, welcome back to our YouTube channel. And today we'd like to revisit the topic of short cervix because of our previous video. We're getting much more questions on this topic. Now, short cervix, as we explained previously, is a prominent cause for late miscarriage. So, you as a patient, let's say you do have histories of miscarriages, do take note on when they happen. Do they happen after the first trimester? Do they happen repeatedly around the same area, causing premature birth or a late miscarriage? So usually around the third month, fourth month. In short cervix could be a potential cause. How do you get a short cervix? It could be congenital, which means you are born with it. So this type of patient usually is difficult for them to detect because they are not aware of that they have a short cervix. So your doctor can actually diagnose this beforehand, before pregnancy. You do need to request this ultrasound to measure the cervical length. Usually patients who have a history are only aware. Those who do not have a history, then you need to actually request this examination. Another thing is that you can acquire this condition from surgical procedures of the cervix. Most notably is that you've gone through cervical biopsies, several cervical biopsies where they remove tissues from the cervix, causing them to weaken. Furthermore, you also have gone for cervical conization, which means there's already presence of cancer, so they have to remove large parts of the cervix. This can also cause weakness, dramatically decrease the length. Furthermore, if you have experienced any trauma at that area, for example, accidents, it can cause damage and weakness and shorten the cervix. And also, if you have had emergency deliveries causing tearing at that area, history of pregnancy, deliveries, it can cause trauma as well. So these are things to keep in mind, and then go for the proper diagnosis if you do have history or if you are just a little bit worried. So as we've talked about how to diagnose, how do we treat this condition? The Antai hospital specializes in the treatments of miscarriage, and short cervix induced miscarriages are known as pressure induced late miscarriage because the short cervix is unable to withstand the large pressure of the pregnancy because it's expanding constantly, exerting pressure where? On the cervix. That's why your cervix is actually the determining factor for when you begin to deliver. So it gradually decreases in length throughout the entire pregnancy. Once a certain length is achieved, your water breaks and you go into delivery. What happens if you have already a very short cervix? It continues to shorten and dilates prematurely before time is up, before the pregnancy is fully mature. It already opens up, causing water to break and pregnancy to exit. A very avoidable miscarriage. This condition is easily treatable at Antai Hospital with our double anti-cervical ring, one secured in the outer orifice, one secured in the inner orifice, and you are guaranteed to have a successful pregnancy. Now, this treatment is easily conducted via 3D laparoscopy, and you will not have any scarring post surgery, and you can quickly go on to conceive without any concern. However, you do need to keep in mind that this surgery can only be done before pregnancy. So please plan ahead. We always repeat that to our patients to actually plan ahead and receive treatment ideally before pregnancy, regardless of what condition. Because we can't really do invasive surgery during pregnancy. Can cause some issues as well, and also concerns for the couple. So all of that can be planned ahead. Now, this treatment is so effective that we offer full refund guarantee. If you do experience any miscarriage after receiving our treatment, then you have the obligation, you have the right to request a full refund, which we will fully cooperate in. So short cervix leads to late pressure induced miscarriages, which can be avoided with the correct treatment. Now, our anti-cervical ring does just that, and we do not need any stitches, causing no bleeding, no infections, no hemorrhage, no tearing, and the anti-cervical ring is very flexible biomaterial as well, so there won't be any immune rejection reactions. And as the pregnancy grows, as the cervix expands and shortens, it will also expand according to its width. So it's a very flexible biomaterial, very technical, very smart biomaterial that will adjust. So it won't affect any blood flow and won't affect the fetal development. So if you are interested in our treatment or more details on this topic, please visit the website and talk to our consultants directly. If you do have a history of late miscarriages caused by short cervix, please get in touch with us as soon as possible to receive this treatment. This treatment is easily conducted and you can be guaranteed to gain successful pregnancy. Avoid unnecessary miscarriages with the correct doctors, correct treatment, and with our guidance, your pregnancy can be secured. So I hope this video has helped on the topic of short cervix. Please leave some comments down below on the next topic you want me to cover, and also stay tuned to the next one.